clinical trials are all the buzzword now, right? Sarah Saratella is the Director of Communications for the Institute for Translational Medicine, a lecturer at the University of Chicago, and Director of Save the Humans campaign, which we'll find out about in a moment. Sarah, what is the Institute for Translational Medicine? It sounds like it might be the Institute for people learning to speak Spanish and they translate it. I don't think that's right.
You got good gut instinct, Steve. It is not quite that. It is a collaboration amongst some of the top academic medical centers in Chicago, University of Chicago, Rush, Loyola University at Chicago, North Shore University Health System, Illinois Institute of Technology, and Advocate Healthcare. And the goal is to help get breakthroughs made from in the lab out into the real world, helping people as soon as possible. So that translational key gets from moving it along the spectrum, translating it from the bench to the real world.
And we'll talk about how pets are woven into all this. And what appealed to me in part, there are lots of moving parts to all of this, but what appealed to me is clinical trials is something a lot of people hadn't even heard that term before the pandemic. And I've talked publicly about how I'm in a clinical trial for one of the vaccines, for the Moderna vaccine. And people don't know what clinical trials are, why they're important, but yet every vaccine we've ever taken, any drug we've ever taken that's not over the counter, and even those mostly that are over the counter, all of those have been subject to a clinical trial, at least one clinical trial at one point in time. Can you talk more about that?
Absolutely. You're so right. Every bit of healthcare we receive today, whether it's at the doctor's office, whether it's going to the pharmacy and picking up something over the counter, has come from health research and is thanks to people like you, to everybody who has signed up to participate and team up with researchers and scientists. Because all of the donations, all of the money in the world for research, when people run races and do walks, doesn't matter if we don't actually team up and participate in the studies that they've funded. And so this initiative is so special. It includes the Institute for Translational Medicine with all of those groups I mentioned, in addition to Northwestern University and the University of Illinois at Chicago, to help make health research accessible to everybody for the first time at a big scale in Chicagoland. Because until now, it's been hard for people to find. You ask folks if they want to help their family and their friends, beat breast cancer, find new treatments for heart disease, to find a cure for COVID. People say yes, but they don't know where to go. And so we've created a really easy platform for people to access those opportunities with just a couple clicks of a button on their smartphone.
And what is that platform?
That platform you can find at savethehumans.org. You sign up, and once you do, it matches you with opportunities for the health areas you care about. So you're in the driver's seat. Kind of like a Match.com, gives you information on volunteer opportunities, ranging from COVID-19 vaccine opportunities like you participated in, to things that people can do from home with their pets, literally from their couch. Surveys to get more information and data about mental health. There are actually programs you're trying to see that can help boost mental health during the pandemic that people can do from home, as well as seeing how people are impacted by things. So there's a whole range. Health research can be as simple as providing information about your experiences to participating in a clinical trial and trying a vaccine. There's really something for everybody, and it helps make the world a better place, and it helps humanity live longer so that we can be around for our pets, because our pets need us, which is why they're mobilizing to save the humans.
All right, and that's Save the Humans, so it's SAVEDAHOOMANS.org. Now, you mentioned something that's really interesting to me, lots of things that are actually. One is that, all right, a lot of people might be interested in participating in clinical trials, but it's not only clinical trials, it's maybe filling out a survey about how you feel about, for example, being quarantined, or, for example, now you're on this medication, you're on the medication but how are you feeling? So you're not being put on that medication. That already has happened. It's maybe something that's approved, but you want to know. So it's not all about vaccines and drugs.
100% correct, Steve. It's about finding information to help people live a better life. And so that can look like those surveys from home. There's actually everything from filling those out to doing some phone calls with study teams and scientists to sharing your pandemic experience about food or access to different resources so that different changes can be made at even a systemic level. Hopefully we don't have a pandemic again, but if we know how it's impacting us, we can understand the problems and work to fix them together. Mm-hmm. So it all comes down to just getting knowledge, science, understanding what it is so we can work together to make things better.
Now, how do pets work into all this?
Yes, pets are so important. As we all know from having pets, they make us feel good. They are a joy to our life. And there's actually science that shows, people have participated in studies that have shown how pets help our health. And that ranges from decreasing our stress levels to boosting our mental health, to helping us get more exercise. And this campaign deals with the pet side. So the Save the Hoomans is in dog speak. Doggo Wingo meets LOL cats, the internet meme talk, because the dogs are the ones who are trying to tell us humans why they love us and why they want us to sign up. Because the only way we can work together to have longer, happier, healthier lives with our pets is if we do help find these answers, find new treatments and cures.
Now, of course, the same is true as for our drugs, drugs for pets. So there are clinical trials for any drug or vaccine, for that matter, your pet has ever had. There were clinical trials along the way. At some point in time, do you perceive posting those on the site as well?
The trials for pets specifically?
Mm-hmm.
I think that's a really awesome idea that we should look into. I mean, if there's a platform that can match humans to opportunities, why can't there be a platform that matches our pets to opportunities for those? I love it.
I can give you some of those. No problem.
Let's talk more, Steve. I love it.
I will do that. So again, that website, and it's interesting to look through, and it's interesting to see what physicians, and it's not only physicians, it's psychologists, psychiatrists, what the interests are right now and what the focus is right now. And as you mentioned, you could have, and it's great to have all these walks and runs for breast cancer, you mentioned, or Alzheimer's disease or multiple sclerosis, whatever it is. And then all that money is raised over a period of time. A drug is available, but without people that are willing to try that drug, there's no way to know and there's no way to get it approved. That's just how it works. And then on the other side of that coin, people say, I don't even know where I can go. Well, now there's somewhere for you can go to get information. SaveTheHoomans.org, SaveTheHoomans.org. Sarah Saratella, Director of Communications for the Institute for Translational Medicine. Thank you so much.